Hi, Kylie. Welcome. I am really excited to have this conversation with you. Nutrition is something that I've always had a bit of a passion for. I actually originally was going to go to university to become a dietitian, but when I went through pelvic surgery a few years ago, about 2.5 years ago, I really was focused on what I could be doing nutritionally and even with supplements to help support me through that journey. And when I found you, I was really intrigued by the information that you were sharing as it pertains to surgery, not necessarily pelvic surgery per se,
Right.
but that could potentially be part of who you're speaking to. But I'm really excited to learn more. So can you give us an introduction about who you are, what got you into this world of nutrition as it pertains to surgery?
Yeah. Thank you for having me on. So I am a registered dietitian, and I have my master's in my undergrad and my master's in nutrition. And when I graduated, I moved up to Boston. And after graduation, I'm sure, kind of like you, like you're given basics, but you're not really trained. So I fell upon a post-surgical center in downtown Boston, and I just had this amazing mentor, and she just really took me under her wing and trained me to love post-surgical nutrition. And that really took the client now, patient before, is just preparing them for surgery, which I'm learning later. But in the hospital setting, you're seeing where they're at. You're trying to maximize their nutrition after surgery and trying to heal their incision as quickly as possible. And being in Boston was so amazing because they take you so seriously. And so that's what I did for close to a decade. And just really honed in on that, and then took some time off, and then like several years later, camping with a plastic surgeon, and just kind of asked him what was he doing and for his clients after he did these major surgeries, and he just said nothing. We just send them home. And I remember being horrified for every woman out there, but it wasn't his job. It wasn't his job. So that was it. So I was like, boom, I found my calling. I'm really into equity care for elective surgeries, and for surgeries in general when they just send you home, and they don't give you anything. So that's kind of where it started, and that's what I'm doing now. So I'm doing elective surgeries, but of course honing in on cosmetic and plastic surgery. But I love it. I absolutely love it. So that's
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 very
that's my
cool.
history. Yeah.
That's very cool. And
Yeah.
what do you mean by equity? Like when you say equity, I forget even what the term was. You just said the
Yeah.
word equity, so I wasn't quite sure what you meant by that.
Yeah, so actually, I love that you said it because we were developing my website, and we created this term, and I was like, this is amazing. But what it is creating an equal balance of seriousness for all surgeries. Whether you are saying this is an elective surgery or whether you're in the hospital and you have to have surgery, we have to treat it the same, especially for women to advocate for ourselves. But we really have to treat this as the same type of surgery, as serious as it is, and that giving the proper care before, during, and after surgery as if it was any other type of surgery. I think that is what I've really jumped on even the last few weeks, of just having equity care for elective surgeries, getting as serious as you can, because the consequences are going to be the same, whether
Right,
it's elective
right.
or not, you
Yeah,
know?
exactly. That's such an important point. Thank you for
Yeah.
clarifying that.
Hmm.
So you focus on elective plastic surgeries, but kind of what you were to kind of reiterate what you just said, that surgery is surgery. And while there are different
Surgery,
surgeries,
surgery.
there's principles that remain the same. There is, kind of chosen trauma, if you could
Right.
say that, to the
Hmm.
body.
Hmm.
And there are things that we can be doing knowing that's coming up, things we could be doing to prepare, and also things we can do to recover. So you focus
Right.
specifically on the food piece, which I love. And I don't really know very many other people like yourself talking about it. So where would
Right.
you start with somebody? Well, like, I guess because of what I just said, surgery is surgery, but are there innuendos, and you can kind of make that part of your answer? Are there specific cases or types of surgery where you would make a different plan for somebody when
Hmm.
they're starting? So let's start with the somebody who is having surgery, what would you recommend to them from a nutrition perspective in terms of preparing for that surgery?
Yeah, okay. So across the board, no matter what type of surgery, getting labs, but getting appropriate labs. That would be the very, very, very first thing. About 30% of my clients are coming to me undiagnosed prediabetes and elevated cholesterol across the board. Whether they've lost 50 pounds or whether they haven't lost weight, or no matter what, that's what is coming to me. So I would say, whenever you're thinking about having surgery, getting baseline labs to check prediabetes, inflammation, your iron levels, ferritin, those are going to be really the basis, and your albumin, the basis of how well you're going to go into surgery. When they do studies on nourished patients going into surgery, they look at that, at those parameters to see if this patient can go into surgery safely. So getting those labs, hands down, number one, and that way you can kind of have a foundation or a jumping off point of what your diet looks like. And a little tidbit there is, like I said, with the pre-diabetes, so I'm seeing more clients with this going into surgery. Well, after surgery, it is trauma. Your blood sugars are naturally high. Number one, research shows that totally impairs your incision care. There was a huge meta-analysis about that. And so we want to make sure that your blood sugar is stable, but also the common treatment after surgery is, pound juice, drink tons of pineapple juice, which is really affecting your healing. So knowing where you're at before surgery is hands down. The second thing is I don't talk about it enough. I need to talk about it more, but I created this little easy thing called a 2.0 formula. And it's called 2.0 because women were saying that, after cosmetic surgery, it's like them 2.0, like their name, but 2.0. And so I just developed this formula. But it's 2.0. So it's 20 grams of protein every meal, 2 cups of produce, lunch and dinner, and then 2 days of resistance training, getting that core and your back strong for your surgery, no matter really what type of surgery. And the reason I just did this simple formula is because people are not consciously thinking about what they're eating on a day-to-day basis. And so that is the one thing. So just kind of being more conscious of the protein and quality protein, I have to say. Not collagen. We're not taking, collagen's great. I take collagen. But for, not as your protein source. So having quality protein, looking at our fruits and vegetables, not just because it's fruits and vegetables, because we're transforming our gut while we're doing this, which is important as well. Giving us our antioxidants to help lower oxidative stress, which puts us at risk after surgery as well. So that's 2, the labs, and then the 2.0 formula. And then number 3 is, I call it training your palate. So the majority of us, and then even if we're eating healthy, we are eating a lot of salt, a lot of sodium, and a lot of sugar. And after surgery, sodium shows up so fast on your body. And so it's really training your palate, because it's not something temporary that you have to do low sodium after surgery. No matter what kind of surgery, lower sodium, you will swell after surgery if you don't have a low sodium diet. Or really, most really like any kind of healthy diet. But training your palate before surgery to start incorporating foods that are going to be naturally low in sodium, and expanding your palate to different flavorings, spicy, hot, acidic, things like that, so that after surgery, you're not trying to do everything at once, because it's hard. Mm-hmm. So those would be my 3 things. Yeah.
So I have a couple of points I want to ask, kind of expand upon there. Yeah. When you're talking about a lot of people coming in with high cholesterol and prediabetes, is the population that you work with, are they closer to menopause or post-menopause on average?
They are, nope, they're younger. So they're like around 35 to 40. So I'd say, premenopause, right? Yep. Premenopause. Yep. But it's about 30. The majority of my clients are between 35 and 40.
Okay, interesting. I as you're talking, I'm thinking, I'm post-menopause now, and I do I'm doing a practitioner support certification, so learning a lot about menopause, and knowing that we are at increased risk of diabetes. Our cholesterol is typically higher post-menopause. So I was just wondering if that was the case for your population, but also then good to know for people who are going into surgery during that time of life, if they are post-menopause, knowing that based on what you just said, we are typically more elevated in those two categories.
Yeah, for sure. And I
well.
think we're being taught that it's inflammation, 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 but I will check inflammation markers for my clients and they're normal. And I don't know the strong research behind inflammation, but I'll just check that marker and it'll be normal, but the blood sugar and the cholesterol will still be there. So, and those are markers that your surgeon will not recommend. Just to FYI, most surgeries are not going to recommend those labs, but it's just important to do it because otherwise you're not going to realize it until you go to your next PCP appointment a year later,
And that sort of segues into my other question with regards to checking inflammation. Is it CRP that you're checking, or is there another one that you like?
Yes, I usually check a CRP, and that was one of the most common questions that I got when I first started was, what do we eat for inflammation? What do we do for inflammation? And so I did my research and I tried to really teach about it. And then every single person that I would check, it was normal. Every single person that was concerned about it. And like I said, I haven't done a lot of the most recent research, but I was just finding that it was all normal. And so I just kind of had to draw back the curtain a little bit and say, we need to just go back to the basics and let's just focus on this basics, because inflammation, let's not worry about that, because that's, according to your blood work, I'm not seeing that. Now there may be underlying inflammation going on because of your diabetes, because of cholesterol, which is what we hear as well. But it doesn't matter, right? What doesn't matter is how you treat it's going to be the same.
Right.
So I go about it like that.
And so I guess, being another person who's asking that question, do you recommend then a low inflammatory food diet pre and potentially even post? We haven't gone to the post yet, but still focusing on the pre-surgery is like, I think about low FODMAP, the AIP diet, there is low inflammation food. So is that something that you would have people focus on, even if their marker said it's not something that you would need to worry about?
Well, I don't, but I do. So instead of confusing them and saying we need to do inflammation, for most people, it's just too much information to handle because they're prepping for surgery. Because your brain is in 1,000 directions because you're preparing for your own surgery, right? Because it's elective. So what I say is, in general, what I am offering is a low inflammatory diet, right? But I'm not teaching that. I'm teaching the protein and the 2 cups of produce, and that's naturally anti-inflammatory. But at the end of the day, research doesn't show it's going to be inflammation that's going to prevent them from healing. The research shows, are they nourished before surgery? Do they have protein stores before surgery? Do they have all their micronutrients? So I focus on that, and then naturally it's going to be an anti-inflammatory diet. But I don't bring that word into the vocabulary because I feel like it's going to confuse my client.
Yeah, totally makes sense.
Yeah.
And then on the protein piece, for my last kind of piece to expand upon here, there's a lot of talks specifically now with the population that I work with, kind of perimenopause and postmenopause, about upping our protein and how very few people are actually getting the adequate amounts of protein.
Right.
And this was something that I really focused on more so post, but, thinking now, I probably should have done it beforehand too, but I wasn't necessarily thinking in that way. But protein wise, why is protein important, and what do you recommend? Is it in line with what the recommendations are for protein, or do you go even higher than that as you're preparing for surgery?
Well, yes. So as prepare for surgery, I don't go higher. I just make sure that they're more conscious of it and that they're knowledgeable of protein. Across the board, they're just not eating enough. I think there's a stat out that says only 30% of us middle age are actually eating enough protein. And of course you get different people with different versions of how much protein. But I do about 0.8 to 1 gram, per kilogram. But really it's about, are you eating adequate protein every single meal. But then after surgery, really depending upon how many surgeries they're having, because a lot of women are doubling up on their surgeries, then I give them a lot more protein after surgery. Did that answer your question?
Yeah. And so what is protein doing? How is it helping us?
Oh yeah. Okay. So protein is really, of course, as we know, it's made up of all the amino acids. And after surgery, your body needs certain amino acids, and they make them on their own. But after surgery, some of the amino acids become what's called conditionally essential, which means that your body has to eat them in order to make them because it's going through a traumatic stage. And so, some of those amino acids are something like arginine, okay, or glutamine. So we have to eat those in food form in order to meet those amino acids. Those amino acids are going to go to your muscle, the tissue that was broken, and they're literally going to build the muscle again, stack by stack, as if they're a building block. And so that is what protein does. Now, the amino acids all have functions for surgery. So for instance, we recommend whey protein, which is a derivative of milk, because whey protein is super high in the amino acid leucine. And leucine has been found to, studies have shown it's one of the best amino acids to help rebuild muscle tissue. So at the end of the day, it helps rebuild the muscle that's been broken from surgery and help it put it back together.
Got it. Makes sense. And now on collagen. So you pointed out that like collagen is something that I take, I recommend many people take. I think it's something that, again, some people probably are deficient in, especially as we're aging. But I hear a lot of people talking about protein isn't necessarily counted in your total protein count for the day. So it's kind of its own separate category, even though it's listed under protein. So why is that? Why is it not? Is it because of the amino acid? It doesn't contain the amino acids we need?
Yes. So I take collagen, and I think it's a great protein to add in. But I just tell my clients I have a term that's called for the sake of surgery. So for the sake of surgery, we are not counting this towards your protein needs because it's missing 3 amino acids. I believe it's methionine and tryptophan. I'm not quite sure, but I know there's 3. It's missing, completely deficient of 3 amino acids, which does not make this what's called a complete protein. It does not supply all the amino acids for your body to make it, to break it down and to rebuild the tissue. So we do not count that towards our protein needs after surgery.
Right.
But I mean, I take it, I like it,
Yep.
But for the sake of surgery, it's just not it's not a protein supplement that I recommend.
Is there anything that the collagen would be doing for the sake of surgery?
Well, there's research, and probably the brand that most people are using. There's a patented collagen out that has been shown to actually help with cellulite. So that's why I pay attention to it, because of my niche, to help with skin turgor and to help with cellulite. So it's still a great additive to your diet.
Right. And are there any, like staying on the preparation, are there any foods we should avoid? So you'd mentioned protein, you'd mentioned antioxidant, you talked about your 2.0 with the vegetables. So that's kind of the general guideline, I guess. And then are there foods that we should make sure are not on our list or as part of our daily diet?
I wouldn't say on the daily diet, but I say that week before surgery is when you have to just look at your diet even more. Your surgeon, of course, is going to give you a huge list. But something that I added on recently was adding to eliminate foods that have SGA, which is a glycoloid, and it basically prevents anesthesia from leaving your body. So there's a study out. It's a relatively old study, but I have incorporated it because I felt no harm, no foul. It's something that could actually really help you. But the SGAs prevent the enzyme from breaking down and having anesthesia detox from your body. And so things like tomatoes is something that I no longer recommend. Potatoes, something I no longer recommend, like that week before surgery. And also before surgery, I actually Googled this one time just to see what other surgeons are saying. It's all over the place. It's absolutely all over the place. But the one thing I tell my clients is we're not doing beef. We're not doing anything that's going to sit in our stomach. And different surgeons say different things, but I do recommend super high fiber foods that are easily going to go through your body the week before, as well as, I think you said avoid, but we do want to have like apple. I recommend a lot of apple juice, electrolyte water. I recommend all of that before surgery as well.
Okay. And I'm assuming things like you've talked about, obviously avoiding the sugars, the salts, so processed food, that type of thing. So making sure we have nice, good, whole foods. And can you explain again, what does SGA stand for?
Oh, I don't know.
Oh, sorry. Okay. So is it an additive, or what actually, like, how would we know if a food has it in there?
It's just a compound that's natural. It serves as a natural insecticide in plants as like a protective measure, but it inhibits like enzymatic properties in our body for anesthesia. And so, it is. It's very interesting. So that's why I don't recommend it. But yeah, I think the salt thing is something that's super important too, just for the sake of just expanding our palate to get used to the food that's going to come after surgery.
Yeah. Yeah. And so tomatoes and potatoes, I'm thinking of they fall under the nightshade category. And a lot of people can experience joint pains and inflammation with nightshade. So I'm going to look into that and just see if maybe all of the nightshades have this.
It probably
SGA.
does. I'm almost certain it does.
Interesting. Cool.
Yeah.
Okay. What about then, before we move on to the post side, because we're kind of going to cover the similar questions there, but what about supplementation? So most dietitians and nutrition people that I follow are always kind of taking a food first approach, but are there any supplements that you would say could play a role or are absolutely essential that we consider? So collagen, I guess some people could argue that is a supplement, but what about things like vitamin C or fish oils or vitamin D, that type of thing?
So I love that question, because oftentimes what's being taught is we say we need vitamin A, we need vitamin C, we need vitamin D, but what's happening is people start vitamin stacking and then they start missing out on micronutrients. So while I'm a food first dietitian, for the sake of surgery, I don't mess around, right? Because we just simply can't get everything in unless we really know what we're doing. So absolutely supplementation before surgery, hands down. And so what I recommend is you need to get on a good quality, clean protein powder, which is what I always recommend, like an organic whey that has nothing in it, because all these protein powders have all these additives, or a plant-based protein, which would either be like a soy or a pea protein or like a mix, but it needs to be a complete protein. So hands down, starting that, adding in. And then in terms of supplementation, it should be, there's surgery supplements, there's like brands. Really the only one right now that's out that I do recommend is Vitamedica. It's one of the oldest ones. There's others out there, but I'm not really crazy about the companies themselves and kind of how they run their business. So I really like Vitamedica, which is really just a well-rounded multivitamin, because the majority of Americans are going into surgery with micronutrient deficiency, which are like some of the B vitamins, the thiamines, things like that. And those are critical nutrients in order to heal after surgery. Like you need those in stage 1 and 2 of the healing process. And so we don't take chances. So we have to have a good supplementation before surgery. And I recommend that the minute that you decide that you're going to have surgery is the minute that you're getting on a multivitamin with minerals. And if you don't know what that is, go into a natural food store, because they usually have good quality supplements, and asking them, what is good. But I like brands like Solar Ray, Garden of Life. They got bought out by Nestle, so they're so-so. But
yeah.
So there's lots of good brands out there. But definitely, I never recommend individual supplements. I always recommend a well-rounded multivitamin, because it can cause toxicity more than anything else if we're not careful.
And then I didn't send you this question ahead of time, but Is it, no, it's just, it's on the flip side of that is like, are there, because I know that the doctors will often say, make sure you, anything that could thin the blood, anything that could
All right.
interfere with. So are there supplements that we should make sure are not in our vitamin stack? And as you're saying, we don't want to do a vitamin stack, but are there things that we should make sure we're not taking as we prepare for surgery?
So really the biggest vitamin that has the most research is vitamin E. That's one of the biggest ones. What's come out recently, and I hope that I make sense when I say this, is they say no omegas because they say it thins the blood. And I'm actually going to work with my team to get the research behind that, because in the hospital, they give omegas right before surgery in tube feeds, right? So they're giving it to them before, during, and after surgery. I don't know how it entered the layman. I don't know how it entered the cosmetic surgery space. But basically, the biggest ones are vitamin E. That's one of the big things. And your surgeon will likely say omegas as well. And those are the two biggest ones. And then the other ones that they also say in terms of food would just be ginger, garlic. Those are the two biggest ones. Cool.
Okay.
Yeah.
So now we're going to go, well, actually one more question here, because this is also going to be something I ask on the post side, but
Okay.
what role does hydration play in the pre, and then we'll talk about post after, but should we be, I think we should always be well hydrated, but should we
Right.
be extra well hydrated before we go into surgery?
Yeah, so, I mean, they're going to give you a ton of IV fluids during surgery. However, that week before, especially, I usually recommend you're doing a minimum of 75 to 100 ounces. You're trying to hit that on a daily basis. But hydration is really what's going, that's the majority of your blood composition. And so when you have, if you've ever remember getting your blood drawn and they can't draw blood because you're dehydrated, I don't know if it's ever happened to you, but it's happened to me. That's just a reason of having hydration means that you're hydrating your blood. If your blood is hydrated, your blood can move to your incision. And if blood carries the nutrients, and it can carry well because it's hydrated, then your incision can receive nutrients in order to heal, right? So that's the important part of hydration. On the pre-op, it's important, first of all, to just do it for constipation purposes, right? We've got to prep our bodies as well. And for the myriad reasons that we all know about, fatigue and how we think and things like that. But before surgery, I really like to tell people to not only do water, but I do recommend electrolyte water before surgery. I think that's super important. It's almost like getting an IV before surgery if you do it right. And then also fluids that contain sugars. So they have research about like glycogen loading before surgery. And so things that are like apple juice, even diluted Gatorade, things like that before surgery are helpful. And then of course, after surgery, that's going to play the natural part into healing and also to prevent constipation. Mm-hmm.
And that, like, usually in surgery, you're not allowed, like they say, nothing but water by mouth. But if you have electrolytes, that's typically allowed.
I don't know. Every surgeon's different. I usually just tell them stick to water.
Yep.
Don't play around. You don't want to get your surgery canceled because you drank,
right.
a Gatorade.
Yeah. So these are kind of guidelines for that, like the week before, as you mentioned, and then that 12 hours or whatever the guidelines are provided with your surgeon.
It's usually right. And every surgeon's different,
Yeah.
But the guidelines are changing, and it's a good thing because the guidelines are really changing that you can have, instead of this MPO after midnight, the guidelines are changing to no food 6 hours before your surgery, and you can ask them to drink up until 2 hours before your surgery. And they've actually found that the patients have better results by doing that instead of a long fasting. And that's what's happening in a lot of hospitals around the world, but the US is a little bit slow on that. So for the most part, surgeries here in the United States is like, NPO, nothing by mouth, after midnight.
Got it. Okay.
Which would include water as well.
Right.
Yeah.
Okay. So then now switching to the post side. So here we are now.
Okay.
We've followed your pre-plan. We've had our procedure, and now we're on the recovery phase. And I always am a little alarmed by food in hospitals. If you can call it food. And so sometimes some people may be released on the day and can go home and have their own meals. And I'm assuming you would make a recommendation of prepare some of those meals ahead of time, or have people that can help you. But some people may have to stay in hospital, which is not, I don't think, super ideal from a nutrition perspective. But let's talk a little bit about first, what are the important kind of pillars to focus on from a recovery perspective as it pertains to nutrition?
Well, it's completely different. Are you talking about in general, whether you're at home or in the hospital, or?
Yeah, in general, and then we'll focus a little bit on that. Yeah.
Okay. So the first thing first is to get the gut moving after any type of surgery. Any type of surgery, you want to stimulate the gut because you don't want a post-op ileus, which is kind of like a twisting of the bowel. So you can do something that's very small, like even chewing on gum.
Sorry, I just want to interrupt. What would cause a post-op ileus?
Actually, I don't even know if they even know what causes it. I think it can just happen after surgery, but it can be prevented by stimulating the gut to move after surgery. I think it's probably because of the anesthesia and the medications, and the gut can stop because that's what it's doing, and then it can twist. It can have a blockage.
Got it.
So you want to stimulate the gut. So that would be what's an old school way, what's called sham feeding, and that is chewing gum, and that can actually stimulate the gut. So that would be hands down number one. And number two is you do want to start nutrition. The research shows that the better recovery is you want nutrition starting as soon as possible. So drinking, I even recommend, make your liquids even nutrition. So unsalted, unsalted bone broth, even if it's dairy-free, like a soy milk or something like that. Starting nutrition hydration as soon as possible. Those would be, I think, the two biggest things.
Okay.
Yeah, and then if you're going home, I am super vigilant about constipation. I said you do whatever you can to prevent constipation, because constipation and pain will prevent eating. And if you're not eating, you're not healing. So medication regimen is an absolute must. And a lot of people forget about that, or their caregiver doesn't give that to them. And then it just can create a snowball of difficult healing.
Yeah.
Afterwards.
Yeah. I remember my doctor saying, don't try to be a hero, even if you aren't necessarily feeling discomfort, stay on this plan, because it's harder to catch up if you aren't. And I was really grateful for that advice, and also for the medication that I had, because and it's funny because I talk with a lot of people who go through surgery, and some of them are just given, kind of just say stool softeners is one thing, but for pain management, they're often just given Tylenol, which I think is not necessarily enough. And then I think they're impeding their recovery because they don't have enough pain management to help them.
Yes, absolutely. Yeah, I completely agree. There's a medication that's coming into the plastic surgery called Exparel, and it's basically they don't have pain for 3 days after their surgery. Wow. And it's expensive, and it's an additional cost. So most surgeons don't include it. So the patients have to pay for it. So not everybody does it, but I am like, do it. I mean, if you can do 3 days of post-op and not have pain, this is not the time to be a hero, right? We're not. This is a time to control everything you can medicinally, because we have to heal you, and that's number one.
Yep. Yeah, I agree. And totally agree on the constipation piece as well too. And especially in my world, as it pertains to pelvic surgeries,
right.
The first post-op poop can be really scary, because some people may be having surgery for a rectocele, where pooping has historically been very challenging, and constipation could be a contributor to what they had been dealing with. So it's like the first postpartum poop, right? You're just thinking, it's right. You're afraid, and when you're afraid, you're tense, and that's going to impede the success of having a bowel movement. So I always agree with you so much. I always prioritize getting the gut going and getting poop optimized. Yeah.
And surgeons they often just give, as well as just Tylenol, sometimes they'll just give, a stool softener. And I used to go with it, and then now I'm like, no, we are not going to give a stool softener because you are up against hardcore narcotics and you're filled with anesthesia. There's no way that your body is going to work well with just stool softeners. I mean, maybe 1 out of 10 of my clients are okay with it, but the majority, it's like, no, we have to do something more aggressive for sure.
Yeah. Yeah. Okay. So from an actual food perspective and nutrient perspective, what are we wanting to focus on from a post-op recovery perspective?
So after surgery, it's not, I don't say, so I'm developing meal plans for specific surgeries right now. And so I'll give you an example so that we can kind of explain it. So for instance, for your surgery or something, I maybe would do more of a high fiber diet, right, like coming out of the gate with surgery. So the more that I'm into this, the more specific foods I'm dealing with after surgery. So say, for instance, I'm dealing with just a mommy makeover tummy tuck, which would be you're really dealing with big incisions and you want to deal with high fiber foods. So for that one, you're getting in not just fibrous foods, but you're getting in nitric oxide foods that produce nitric oxide, which also help relax blood vessels and let the nutrition go. So I put a lot of pomegranates, in the food. I don't do a lot of vegetables after surgery. I actually do a lot of fruits. That's probably important for your listeners. Go the fruit route the first 2 weeks. It's just easier on your body. You're going to get more of the fiber. You're going to get more of the water. And so I deal with that. That's my biggest ones. And then I also focus on enzymatic foods. So I add in like lots of figs as well. And then just foods that are easy for your body. We do no added salt bone broth, chickpea noodles. We just do easy to digest foods. Some people can handle dairy, non-dairy. So we deal with that. But so for instance, right now I think on one of them, post-op day 1, we have like a chia seed, it's delicious, like a chia seed pudding for breakfast. And so that's going to get your bowels moving. It's also going to give you hydration. It's going to give you fiber. So that's for breakfast. And then for lunch, it's more of like we're doing nuts, seeds, figs. We're doing the enzymatic foods as well. And then for dinner is more of like we're doing the chickpea noodles. I mean, just something that your body you're not going to throw it up. You're not going, something that's easy on your body, but it's very, very nutrient dense. Those are the things that I really focus on. Things for your incision, things for your bowels. And then of course, if you're doing something like lipo, I'm dealing a lot more with foods super high in antioxidants to reduce any oxidative stress after surgery. So I think it depends on the surgery as well. But in general, that's really what I try to do. I think the one thing I want to say is oftentimes I've seen clients try to do it on their own and they hit high calorie, but they can't hit high protein. Or they'll do something high fiber, but they can't do the high protein. So really understanding that every meal is high fiber, high protein, high calorie, every meal. And that takes a lot of thinking, which is why before surgery, really sitting down and creating a meal plan, even if it's something simple, to get you through that first week. That's probably the most important, because if you don't think about all 3 of those, then you're going to be, you may be in trouble at the end of the week.
Yeah. So a couple things I just want to clarify. You said we've talked about protein, so it's helping rebuild and heal and I've got that. What are enzymatic foods and why would we want to pay attention to those?
Yeah, so enzymatic foods are foods that can naturally break down protein. So that's why people are really big into bromelain, right? Because it has an enzyme called papain. And papain pineapple, and they has the enzyme bromelain, but then there's also a papain, which is also an enzyme as well. And so when we have enzymes to help us break down protein, we can break down protein a little bit easier, and that way we can absorb the protein a little bit easier. So having functional foods, like foods that have a purpose, I like to incorporate those because those are natural foods that can help you digest your protein a little bit easier. So they just kind of work like enzyme. An enzyme is basically the term for it is just a catalyst. It helps speed up the breakdown of, say, protein and the absorption into your body.
Got it. Okay.
Yeah.
And so would digestive enzymes be something that would be beneficial at this time to help make sure, even if we are including enzymatic foods, or should that, or even just drinking apple cider vinegar ahead of our meals, would that help break things down better?
Well, I would not recommend apple cider that first couple weeks because you don't know if you're going to vomit. So I always think about that. Like, let's think about if we're going to, if you're going to get sick. So anything that's going to cause any kind of nausea, I say no to. So probably no on the vinegar. But I think the enzymes, that's what bromelain is. It's a pill form of an enzyme. And so there's lots of research out about that. I don't recommend it, but it definitely wouldn't hurt at all. And probably it would help. I usually don't add it after that because they're taking so many pills. It's really a matter of like practicality. Right. Yeah. But yeah, I think it'd be great.
And you alluded to something when we were talking about the you said this would be important for stage 1 and 2 recovery. So what are the different stages of recovery, and how does our nutrition, what role does the nutrition play at each of those stages? Well,
it's hard. Well, the first thing is there's 3 to 4 stages. It's like there's a proliferation stage, the maturation, the mature stage. I don't know. I don't know how to. Their maturation. I'm like the emphasis on the syllable always messes me up. I've been in the South for too long, so now I'm like switching my syllables. But there's 3 stages, and all the nutrients are different. So, for instance, the first stage would be like more the B vitamins, vitamin A, and energy, and then it kind of moves on to protein, vitamin A. But the rule is we don't know when it goes into each stage. We just don't know. So I remember when I was practicing, I was trying to give supplementation at a time when I was thinking, okay, during this stage, during this first 7 days, it needs this nutrient, and I try to supplement with just that nutrient. But the reality is that we don't know what nutrients the body needs at what stage because we don't really know what stage it's in. When I say stage, I don't mean a wound healing stage, like it's stage 3 and then stage 4. I'm talking about just the healing process. We don't know. So really it's just, that's where that comes into having that micronutrient, macronutrient before and during and after surgery, because then no matter what stage your body's in, your body's going to have those B vitamins, that vitamin A, that vitamin C.
Got it. And another point I just want to clarify, when you were talking about fiber and protein and calorie, and you want to make sure we have high on all of those. Why is it important to have high calorie?
I love that. I love that question. And that's probably the one thing that I teach the most now because because it's been taught for so long that it's just protein. So I love this question. So the reason being is because your body, and there's research, I had the book that even talks about it, which is fabulous, but your body has to have energy to heal, and then it needs protein to repair. So if it does not have the energy to heal, the body will start using protein for energy. And it's a hard way for your body to use energy, but your body wants to feel safe as possible, which means that if it's not getting the energy, it takes that protein and uses it for energy. And it's not going to give it to your incision or to your wound. It's going to protect the organs, right? Because you went through trauma. You went through a trauma, right? And so it's protein. And what I see all the time are people hitting the 150 gram proteins, but they're not hitting their calories, and their healing is slowed because their body is not getting the calories, it's using it for energy. Does that make sense? Am I explaining it correctly? So that is why we add in all the proteins. So say we're going to have, a drink or meal, and we're going to hit that protein, but then we're going to have all the extra calories. So we're going to have, we're going to get it from some of it's going to be the fat. It's going to be from, say, our farro or our quinoa or something like that. after surgery because our body has to have enough energy. It's just like running a race, like a marathon, you know? We have to have enough energy to go through this trauma. So that's why we have to hit all three of those.
So interesting. And then to kind of wrap up and talk about the last few points that we talked about on the pre side, the hydration piece is important. Well, before we go to hydration, from a supplement, you said basically stay on that same all-encompassing, get your vitamins and mineral supplement, no extra supplements that we need at this time. Is that right?
So it depends. It depends. So I like to recommend, like after surgery, it kind of depends on how well you're healing. If you're doing a fat transfer, I like to recommend a vitamin D. But I also recommend always a probiotic. That's probably not one thing that I recommend. So like a probiotic before, during, and after surgery, hands down, those are the main things that I'm dealing with. And then if you're a fat transfer, then it's vitamin D. If you're having any incision healing problems, any at all, then you're supplementing with a little bit more vitamin C and zinc. And I like to add in selenium because it's just such a potent antioxidant. And I like to add in those three. If you're seeing that you're not healing adequately, those are the three that I recommend.
Got it. What's the importance of the vitamin D part?
So there's some research that shows that fat transferred cells, so the fat transfer really, they're taking fat from one place and putting it on a next. And these are not just cosmetic procedures. I have a client who has an autoimmune disorder, and she actually lost fat I think right actually on her forehead. And so they took the fat from her thighs and put it on her forehead. As well as breast cancer patients, they're doing a lot of the fat transfer. Instead of having the implants, they're doing fat transfer. So there's several research. They're not, they're in vitro. They're not human because it's just nearly impossible to do this type of research on humans. But it just shows that the fat cells can be retained better in the newly transplanted fat with vitamin D. And so I just started, for my fat transfer patients, I started recommending like a vitamin D just while they're healing.
Interesting.
Yeah.
And hydration, same sort of, make sure you're very hydrated. What would be the reason? Like I think of it as just making sure we're flushing out all of the stuff that came through us, through our body while we were under anesthetic. Any other reasons?
Yeah. So no, I mean that would be one of the biggest reasons, and of course it helps the blood flow to the incision.
Right.
But with that though is I really recommend getting a lot of your water also from your fruits and vegetables, from your fruits, because it's also going to have the fiber to help you carry out as well. And then also the common thinking is chug your Gatorade, chug your juice, and chug your beet juice. I mean, just crazy stuff in the surgery world. And no, we're not doing that. No, we're not doing that. We don't need that, and you're not doing that. Because for so many reasons, we're not doing that. So if we're doing anything that has like sugar beverage, then we're having it either diluted, or we're doing it with like a protein drink in order to make sure that blood sugar is stable after surgery. That's what I see the biggest thing. So hydration, yes, but it's going to be diluted drinks. I usually don't recommend carbonated drinks. I usually just recommend electrolyte waters. Coconut water is fantastic as well at this time. And then your hydrating plants. So for mobility, for blood flow, for everything.
So interesting.
Yeah.
How can people find out more if they would like to work with you or dive more into your content? How can people find you?
Yeah. So my majority of my content is on Instagram. So it's nutrition.plasticsurgery. And from there, you'll probably find everything. My new website is coming out, and the domain should be sulinu.com, Sulinu, or Plastic Surgery Nutrition. I scored that domain. Super excited about that.
Totally.
But usually Instagram is the biggest thing. So
awesome, and we'll have that in the show notes below.
Great.
But thank you so much, Kylie, for sharing
so
your wisdom. That was super, super interesting, and I know everybody will really enjoy that. So thank you so much.
Well, I love your content too. I've been binging it the last like few weeks, and I'm like, this is fascinating. fascinating. This is because I'm like, I need to interview you because I have so many questions. I'm like, I have so many more problems that I didn't know or realize in my pelvic floor.
I hear that often.
Yes,
Yeah.
yes.
Yeah. Yeah. All righty.
Oh,
Well, thank
goodness.
you
All
so
right,
much.
Kim. Thank you so much. I appreciate you. All right. Bye-bye.